Hello there, I'm Brian Taylor, and a very warm welcome indeed to the latest edition of my Herald podcast. It's really just one big topic this week. It divvies up into a couple of areas. It's the pandemic, of course, that hideous plague that has afflicted us all for too long, and whether it's right to be moving to lift restrictions. Now, earlier today, the First Minister said it would be wrong to throw all caution to the wind. She was still cautious, but she also signalled that she was now more optimistic than perhaps she had been about a week ago about being able to shift all of Scotland to level 0 in COVID by July the 19th and to lift other constraints by August the 9th, but not lifting everything. She still wants some degree of common sense, if you like, to attach to that. Now, a final decision on all of that for Scotland will be announced next Tuesday, but let's look at the competing pressures right here and right now on my podcast. Delighted to welcome to my panel from the SNP, Dave Duggan, the MP for Angus, from the Conservatives, Highland MSP Donald Cameron, from Labour, the South of Scotland MSP Martin Whitfield. But I'm joined first from the Herald team by Helen McArdle. Helen, just bring us up to speed on that issue, the issue that was plaguing us all, the record number of new cases in Scotland. We were making records we didn't want. And then the First Minister saying today, maybe still signs for optimism among it. Explain that apparent dichotomy to us.
Well, yes. So the cause for optimism is that we appear to be seeing the first signs of a decline. So to put that into context, and it's very early days, but what Nicola Sturgeon is looking at is the 7-day average. That's what we're really interested in, rather than just each individual day's figures. And when you look at today's 7-day cases, in the past week we've had 20,993, which is a lot in comparison to previous weeks in the pandemic, but that's actually down from the previous week when we had 20,746. So what we've seen really for the first time in the past few weeks, we've actually seen a week-on-week decline. So that's what Nicola Sturgeon is talking about. She's talking about this possibly tentatively being a sign of a decline. That does also tie in with what we're seeing in the 7-day average for specimen cases. So that's the time that someone takes a swab and submits it for testing and later testing positive. We're seeing a decline in those as well. So there are tentative suggestions. As she said, it's a moment for care and caution, was what she said. She also did say, in reference to the announcement next week, that it's always possible to proceed with some things and not others. So there seems to be a suggestion maybe that next week's announcement might be that we adopt the things we planned on July the 19th, but not necessarily all of them.
Yeah, I think it sounded that way to me, and perhaps continuing the use of face coverings, continuing the distancing areas. Let's go to the panel. Helen, come back in and join us in a few seconds. But Donald Cameron, those figures on the record for new cases. I mean, we like to see Scotland setting records. I particularly like to see a Dundonian outfit at the top of the league table, but I don't like it to be NHS Tayside having the worst record for the number of new cases. I mean, out of 10 the worst hit regions in Europe identified by the World Health Organization, 6 of them were in Scotland, 2 in the north of England, and then there was Kazakhstan and Moscow. That is not a good set of figures, is it?
No, it's not, Brian. And as you say, it's 6 in 10 of the European areas with the highest infection rates at the weekend. And that's a really worrying figure and a really worrying headline to be greeted with. And I think the news today that the First Minister said that she's hopeful that cases are leveling off. Now, I'm not a scientist. I don't quite know why that is, but let's hope that perhaps it's the fact that schools, I was told, the fact that schools have been off now for almost 2 weeks may mean that fewer people are mixing together, schools, etc. But I think what it shows is the general point that the vaccination is reducing hospitalizations, and even though the figures are worrying in this third wave, they're not nearly as bad as they were in the first and second waves. And so for those reasons, I would really hope that on the 19th of July, the date that we've been given, we can move to level 0 as we promised.
Okay. Martin Whitfield, what's your take on that? I mean, you have on the one hand the possible optimism of the figures beginning to tail off, but those were really dreadful stats for a short, admittedly a fairly short period, but absolutely dreadful stats, weren't they, Martin?
Absolutely, and I think the tail off is we need to be driven by data. And I know a lot of people say that, and it's very easy to say. But actually, the interpreting of the data is incredibly challenging, and we've seen in the past really poor decisions being made on the back of poor decisions on data. I live in East Lothian, and I've watched East Lothian go up in infection over the past 10 days to not quite top the chart, but to be the highest level area that was previously in level 2. And what we have to say is over the weekend that's been, we had 3 consecutive days where the figures were low. So looking at the 7-day average, it will have dropped. Simply statistically, it will have done. And that's why, one has to admit, these are incredibly challenging decisions that the government and the First Minister need to take.
What's your take? Do you agree with Donald Cameron that we should go ahead in Scotland with moving to level 0 on July 19th?
I think sweeping statements of this is what we should do is it's why we're in the trouble that we're in at the moment. I think it's very dangerous to try and anticipate what will happen. I think there are things that we can draw from it. Face masks, of course, we should carry on wearing face masks. I think that's common sense. But to echo something that Donald said, which is very important, we have to remember, of course, in Scotland that our children have gone on to their summer holidays.
Yes.
And what was previously, when we were previously told schools were all safe and there was no problems there, the most recent figures over the months have shown that the infection rates, particularly in our high schools, and strangely enough at the bottom end of our primary schools, have been huge. And the arrival of the summer holidays means that children are not passing and repassing among strangers as much as they were in schools. And that may well be an explanation for the drop given the period of time. Now, let's bring in summer activities.
Thanks for that. Let's bring in Dave Dugan. Dave, the scientists, Professor Leach, etc., in the Scottish government have said that one of the reasons was that Scotland didn't get natural immunity. He doesn't use the phrase herd immunity, but that's presumably what he means. Didn't get that natural immunity from the early phase because there was such protection in Scotland that we're now vulnerable to the Delta variant coming in. Do you think we're going ahead with liberalisation on July 19? Do you think it's justified?
Well, I think we're on July the 8th just now, Brian. So there's a lot of water to go under the bridge between now and the scheduled announcement of releasing restrictions. So I think the First Minister was quite clear in her underlying ambition, which I think we all share, regardless of our political colours, to get out of these restrictions in the fullest way as soon as possible. However, there's clearly very little point in doing that if it's going to put the public at increased risk of contracting COVID. So
you think it's still touch and go? You don't think it's? I mean, she sounded optimistic, but to be fair, you're absolutely right. She was saying the decision will be taken at a meeting of the Scottish Cabinet on Tuesday.
Well, I tell you what really heartened me about what the First Minister was very clear about was that she will take the decisions that she believes to be in the best interests of Scotland, regardless of whether or not they're exactly the most popular decisions to take. And that gives me great comfort because, of course, she, like every other leader in the world, will be getting advice from her scientific advisors. Now, that's advice. She has to make the decision with her cabinet colleagues. And if the decision is going to be unpopular, I'm relieved that she's going to take it. However, I very, very much hope that she's able to, if not go ahead with the releasing restrictions or go ahead with some key elements of it. And I think, it's really worth pointing out, as Martin said, of all the restrictions that we're faced with, wearing a face covering is not really the most onerous, and I'm not cited on why that's such a priority.
All right, thanks. Let's break down some of the issues that arise. Let's talk about test and protect, testing people, and then the idea of isolation. Donald Cameron, your party, the Conservative Party, said basically the Scottish Government had lost control of that system. What justifies that sort of comment?
Well, I think I could give 2 examples of that, Brian. The first one is that only a quarter of COVID positive individuals are being interviewed within 24 hours of appearing in what's called a case management system in the most recent week. That's significantly down on a month ago, where sort of almost 2/3 of positive individuals were interviewed within 24 hours. That's one example of the system not working. And the other one is figures from Public Health Scotland, the Scottish Government agency, that showed that the number of cases that are closed within 72 hours is now well below the WHO's target of 80%.
You said these are failures by government, failures by the government.
I'm afraid they are, and I think the most important thing to do is to get the test and protect system back up and running properly so that it's effective. It's absolutely critical to our fighting this virus.
Dave Duggan.
Well, I'll tell you what I know, Brian, about Test and Protect is the extraordinary work that public health professionals are doing in Tayside and health boards across the country. The way that my daughter is testing herself, or was prior to go back and forward to school, the amount of times that young people that are known to me have been isolating from school. I think there's a tremendous amount of effort gone into making sure that where positive cases are identified in Scotland, the appropriate measures are taken to prevent that from being.
Yeah, but what about? I hear what you're saying, and I echo your sentiments. But what about Donald Cameron's point? The WHO standard is to close 80% of cases within 72 hours, within 3 days, and for fully 2 weeks we haven't managed that in Scotland. We haven't done that. Now that's falling short, is it not?
Well, over that same period of time, we have had a tremendous increase in positive cases. Now, every capacity.
The system was meant to cope with increases in positive. That's exactly the purpose of the system, is to cope with it. It's not to be overwhelmed by it.
Yeah, no, and it is coping with it, but there's naturally a strain on that system when the numbers are of the nature that we've got just now. And I think, it would be a little bit more concerning for people in Scotland if we had a particularly marvellous system operating elsewhere in these islands, but we don't. This is imperfect, and a lot of people are working tremendously hard to make this work. But, I never used the word overwhelmed, Brian, but it is under tremendous strain.
Okay, Donald, come in again, and then Martin Whitfield. Donald, please.
Yeah, no, I was just going to make the point today that you made. I don't think it's a defence to say, well, the cases are really high. I mean, the system has to be effective when cases are high. It has to work, when it is under strain.
Martin, well, just on that.
Yeah, please, go on, Dave.
I take Donald's. Come back, but the problem that we've got, and as I say, I'm not suggesting for 1 minute that Test and Protect is without issues. I'm not suggesting for 1 minute that it's doing everything that it's absolutely we need it to do. It's under tremendous strain, as I've said. However, we have a system operating in England, the Track and Trace, which is colossally expensive, potentially £37 billion. Its sole objective was to stop a second lockdown, and we're coming out of a third lockdown. So, I mean, I'm not certain that taking too much of a moral high ground is where Conservatives should be in this space.
Martin Whitfield, on this point about Test and Protect.
On Test and Protect, I don't think anyone has said that any of the individual members of staff, or indeed the teams across the Scotland, are not working extremely hard. But the reality is that they too are being struck down with people having to go off, having been exposed to COVID. We should have learned from the initial failures of our Test and Protect system. We should have learned from the first lockdown. We should have learned from the second. We should have entrusted the local authority teams, who are the experts in this, rather than trying to have an almost centrally controlled method. And I think as the numbers rise, as Donald has said, it's shown the failings of Test and Protect, not at the level of people picking up the phones, but at the level of the management and the organisation of it. And Dave raises the question about, his child testing before she went to school, as did my children. But we look at the statistics of the testing that took place in schools in the last week before the summer holidays. And for children at S4 upwards, it was way, way below 6%. Mm-hmm. Those sort of levels, are completely inappropriate if you're trying to use the data.
Dave Duggan, come back in, please.
Yeah, I'm deliberately not challenging Martin on those statistics, but as a little bit of background and contextual information, that's because an awful lot of senior phase pupils weren't attending in that last week.
No, they were. The senior phase had to stay on until the end of term this year. That was a requirement under the alternative assessment model. They didn't go off on exam leave as in previous years. They were all supposed to be there till the end. And the low lateral flow tests in schools were over the last 4 weeks of schools declining. And when the government were challenged on this, there was no answer. There was no answer to it. And yet we talk about the need for data. And without that, there's no way that you can make assessments about the value of whether you're sending bubbles home, selling individuals home.
Let's bring in Helen here. Helen McArdle, the First Minister has said, constant endeavour to improve and upgrade, test and protect, constant endeavour to make the vaccination programme, if you like, more receptive. You've got mobile centres. She's under pressure on these, isn't she? And having to respond.
Yeah, I think there's no doubt that in the last few weeks, the introduction of things like the mobile vaccination vans and the drop-in centres was all about trying to get up. I was having a look at some of the vaccination stats before I came on, and it does look like it's quite stubborn around the kind of the over 40s. We're kind of getting up maybe around about the 80%, and then it's just kind of stalling there. So there's no doubt that we won't see the kind of levels of uptake that we have seen in older groups, and maybe that's just to be expected, and it's nonetheless higher than what we maybe thought at the very beginning.
I was very struck by a remark the First Minister made. She said, "We're all thoroughly sick, thoroughly fed up of this." It was as if she was, recognising that there's going to be a degree of frankly, consumer resistance to further constraints and further appeals, but she's saying, please just give it one last go, wasn't she?
Yeah, because I think that's also interesting, maybe in relation to the test and protect issue as well, that one of the things that was kind of mentioned over the weekend that hasn't cropped up is one of the difficulties, I suppose, that test and protect are coming up against now is a reluctance of people to comply. People, especially if they are either fully vaccinated, or even just partially vaccinated, or as you say, because they're just sick and tired of things, people's willingness to self-isolate is declining. We're hearing of things like people just hanging up the phone or refusing to answer, or contact tracers getting abuse, for trying to do their job. So I think that is a factor within it. Yes, it's true that certainly Test and Protect hasn't been able to meet the target, which is very important, right?
Donald, thanks, Helen. Donald, I saw you nodding there. I mean, it is that there's a weariness, isn't there, and that can lead to a lassitude generally, and then perhaps complacency.
I think Helen's put her finger on it. I think this is a real problem because I think compliance is beginning to fray quite seriously, and I think it's so far it's been our one of the biggest weapons that we've had. The ability of the public, I think, surprised everyone, and the willingness of the public to comply with very strict, and invasive rules on their personal liberty. And I think that that's one of the dangers, and I suppose it goes back to one of the things I said at the start, which is why I hope that we do move to level 0 in 11 days' time, because I think people are expecting that, and they need the certainty. And I think that to deliver on that commitment is really important because it will help public compliance, which I think, as we've seen over the last few weeks and days, is beginning to shatter.
So you have to give people something to get them to comply with the rules and regulations. I mean, this has killed this disease has killed thousands, hundreds of thousands.
I think people need certainty, and they need to know. And I think one of the problems is that rules have got more and more complicated, or at least and also enforcement is becoming a lot more inconsistent.
Donald, go on, Helen. Yeah.
And the compliance, Brian, you're saying, should you give people something to incentivize them? I mean, that's not entirely unusual. I mean, other countries in the world have done that. They've either provided people with hotel accommodation, they've provided them automatically with financial incentives to do it. We've always relied on self-isolation grants, which is hasn't really worked well.
I'll come to the question of the NHS in a moment. We've got a great question just come in from the audience, an audience show. So Janine says, does the panel consider, Donald, I'm going to put this to you, does the panel consider the Delta variant, that's the one that's causing all the problems now, washing over us in the third wave? She's asking, would that have been preventable had the UK government closed the border to incoming flights from India in April? Who said yes?
That was me, Brian.
Go on then. We'll go with you,
Dave. The
Dave.
level of neglect and ambivalence by the UK government to properly marshal the UK's borders, which of course Scotland, where we remain in the UK, is subject to, is unforgivable and will not stand scrutiny over time. And it was all predicated around the UK wanting to curry favour with the Indian Prime Minister and not upset Boris Johnson's scheduled trip to India later on. And it was it was a scandalous abdication of responsibility on the part of the UK government.
Donald Cameron.
No, I don't accept that for a second. It would have been simply impossible for us to avoid any transmission from Europe. We're a connected international country, but when it did spread, we've seen from the Delta variant, it spread very rapidly. And I just don't accept what Dave said. I think it was, I'm afraid to say, it was unavoidable, the Delta variant. And unfortunately, it is, as we all know, very transmissible and highly infectious. And I just don't think
how was it, what way was it unavoidable? If you'd closed the flights and prevented people coming from the Indian subcontinent in certain numbers, surely that would have at the least reduced and mitigated it. I mean, Professor Jason Leach is saying that that Delta variant has been seeded into Glasgow, Scotland's largest city, and has spread out from there.
Well, there are lots of cities in England which also have big Indian populations where infection rates are lower. So, I don't think it's simply a question of saying, that Glasgow's got a big Indian population and that's why it's such a problem. And I think the Delta variant, there are many factors for its spread in Scotland, and not least the football, which we've all been enjoying. But I think has led, particularly amongst younger male Scots, I think that's led to a huge expansion in rates going up.
Martin Whitfield, you're keen to come in on this one, I can see.
I was going to say, I think it's overly simplistic to say that just close the borders and everything would have been fine. But what I do agree wholeheartedly with Dave is the reason for the delay had nothing to do with this virus and had everything to do with Boris Johnson's desire for a trade deal. I think the way that the infection spreads, and I think it's shown almost in what Donald has said there, we're already hearing it's all the football's fault that it spread. When you look at the data, it clearly appears that the Delta variant is affecting males far more than females, which is unusual because the original COVID was working the other way. But we also have the fact that obviously a significant proportion of the population is vaccinated and double vaccinated, although that's not an absolute protection against the COVID. I think everybody will probably know somebody who's been vaccinated who has recently proved positive for COVID. But the fact remains that it is our younger population, as Helen was pointing out, in the rates of vaccination that are being left behind, and that they're not being followed up with drop-in vaccination centres and buses. They come so late to the day that there's no wonder there's a proportion of our population who interact with each other, who are exposed to COVID and who are spreading it.
Forgive me, Martin. Dave Duggan, on this point, and bring in the other element, that today it's been announced by the UK government that if you have had a double vaccination, you will be allowed to avoid quarantine when coming back from amber countries. Nicola Sturgeon asked about that. She said it's something she'll be looking at very, very closely and very carefully, and we'll make a decision in the near future. What do you make of that one, and what do you make of what you've heard from Donald Cameron and Martin Whitfield?
I think that's very positive. I mean, one of the real strains on people who haven't been touched by the terrible grief that comes along with losing somebody to COVID is the domestic restrictions and their inability to get away. One of the sectors incredibly hard hit by the restrictions is the travel sector and the aviation sector. So if we can find a way to safely marshal a set of rules around international travel dependent on double vaccine, and that's safe, then I would welcome that with absolute open arms. But I just wanted to switch back to the Indian variant,
please.
The Delta variant, Brian, because a really important fact, and I take Martin's point that everything wouldn't have been. We wouldn't have completely been able to eradicate the Delta variant from these shores if we'd acted more swiftly on the border, but we would have prevented a lot of it. And as we know, with pandemics and with viruses of this nature, it is exponential. So the more that you get in, the more you'll end up with. So if we could have very much limited that which got in, we would have been able to very much better manage that which then spread at community level. But if you look at the way that India's delay from going on the red list, fully 2 weeks after Bangladesh and Pakistan, where India was sitting right in the middle.
Okay, let's move. Let's park that for a second. Helen, if I can bring you in again. Let's park that for a second. Helen, if I can bring you in, there's been real concern in the last few days and even today about hospitals under pressure, particularly in the Highlands in the Northeast. Bring us up to speed with that, if you would.
Yeah, well, I think the important thing to understand about the hospitals under pressure, which is maybe a bit confusing to people, is you were talking about it, hospitals under pressure due to COVID. That's not exactly the case. Yes, we are seeing an increase in admissions from hospital into hospital, and that, but we're seeing it at a much smaller rate because, of course, we're seeing about 3% of people who get infected feeding through into hospital. It tends to be younger people, not universally, but it tends to be more younger people. They're not staying in hospitals long. So although those are going up, but the real pressure is actually coming in. I've spoken to people in the front line about this in recent weeks. The pressure that we're actually seeing is much more to non-COVID. So you've got accident and emergency departments, which in the past month or so have gone back to pre-pandemic levels. Now you're talking about pre-pandemic summer levels.
Yes.
Now, summer tends to be, funnily enough, the busiest time of the year. But under normal circumstances, attendance levels at summer, maybe they're about 28,000 people a week. But most of those people would have relatively minor illness, broken bones, kids out playing, having an injury, that kind of thing. But what people are seeing is people presenting in accident emergency departments and they've got undiagnosed cancers, or they've got chronic conditions like diabetes, which have deteriorated during the pandemic, and now they're requiring an admission into hospital. You wouldn't normally see the number of people turning up at A&E departments requiring an admission as we're seeing at the moment. So you've got that pressure, you've got those kind of unscheduled admissions into hospital. At the same time, we're also trying to catch up with huge waiting list backlogs, trying to get the elective stuff remobilised. So we've got big demand for that. So that's, again, very different from previously in the pandemic. So that's why we're seeing all this. And compounded with that, we've got the staffing issues with absences. And the absences are down to a mixture of staff either becoming infected, staff having to self-isolate because they're identified as contacts, which is something the government's looking at, and also people taking annual leave, because a lot of people, earlier on during winter, during the second wave, doctors, nurses, all the other healthcare professionals were deferring their annual leave. They're now in summer, they're trying to take their annual leave. So we're losing staff to that number. So you've got this perfect storm. And that is why we're seeing the pressure that we're seeing in the hospitals, and we're just seeing it everywhere.
I think
perfect storm, Donald Cameron, but also a perfect storm, Donald Cameron, but also a hideous challenge. The First Minister says very, very concerned about the pressure on hospitals. Do you still say go ahead on July 19 with liberalisation, even in the face of that evidence of problems for hospitals?
Yes, I do. I mean, let's not deny that. Regmore, the main hospital in the Highlands in Inverness, is one of the hospitals mentioned. But the reason for that is a multitude of factors. Helen's absolutely right that are causing this. And it's not really patient related. It's in terms of COVID positive patients. It's not patient related, but it's to do with staffing. It's to do with all these other things. And I have to say that Helen talked about the backlog. In the long term, there is the backlog. I think is one of the biggest public policy challenges facing any government, including the Scottish government, clearing that backlog of people that are waiting for their operations or haven't been diagnosed. I think it's this huge sort of policy issue that is coming at us. And it goes to show that ultimately we have to strike a balance between, protecting public health, protecting COVID infections rising, preventing hospitalizations, but at the same time, these long-term issues like the backlog in the NHS, have to be balanced against that.
Martin Whitfield, Labour has made a substantial play on this issue of the problems in the health service,
and rightly so. Remember, when the first lockdowns occurred, it was all about protecting the NHS. It wasn't about protecting the NHS because of COVID. COVID was a risk that was going to seriously damage the NHS provision.
Yeah.
And we managed to protect that by cancelling operations, by suspending cancer diagnosis. And what we're seeing now is the consequence of that. Now, we were supposed to have a 100-day post-election plan from the SNP. We were supposed to have the NHS recovery plan coming out of COVID. And here we are at the first step, and it's falling apart. And it's falling apart because, as Helen has said, opening up all of the capacity to the NHS on the backs of workers who are exhausted is causing huge problems. This should have been anticipated. It was always going to happen.
How can that possibly
we were talking about it happening
this is a pandemic. You know, it's not. These are not ordinary circumstances.
No, they're not ordinary circumstances.
It's forced upon the health service.
It has been forced upon the health service, but this is a health service where experts have been saying that the summer was going to be really challenging with the opening up because A&E figures go up. We've always known that because we're moving it towards winter where, last year the flu was very, very low because many people were staying at home, many people washing their hands and wearing masks. This year we are likely to have another flu epidemic and we need to protect against that. This was known by the people who were working in the NHS. Why wasn't it known and planned for better from government?
Dave Duggan, the SNP were asleep on the job, according to that accusation.
Which is complete fantasy, because the NHS, under the control of the Scottish Government, is in a demonstrably better condition than many trusts south of the border. But I don't want to get into a ping pong on that. The Scottish Government, the SNP Scottish Government, recently returned to government with a pledge to increase funding over 5 years by £2.5 billion, because what Martin's point is essentially a point about funding, essentially a point about resources rather. I think if I picked them up right, I'm not wanting to put words in his mouth, but I think he's saying that the recovery that the NHS requires to embark upon is not sufficiently resourced. Now, a lot of that resource, what government can do is it can put in financial resource and it can facilitate through higher education the human resource that comes along with that. But when you have such an external trauma to a well-established system as COVID was to our health service, you can't suddenly just manufacture nurses, doctors, speech therapists, physiotherapists. You can't knit them. They have to come through a training process. Mm-hmm. So we're not even out of the pandemic. So it's a bit much to criticise the Scottish Government for not resourcing the NHS when the principal way in which they do resource the NHS is through finance. So
Donald Cameron, you look unimpressed by those arguments.
I mean, Dave's right insofar as it's partly a question of finance, but it's also a question of staffing. I was my party's health spokesperson for up until the election, and I spoke to a number of professional medical organisations, nurses, doctors, all across the board. And if you spoke to any of them, they all talked about staff morale, staff pressures, stress, all the things. They've been dealing at the front line of the pandemic for over a year, and that they were absolutely on their knees. So I think that's key, and their existing staff. And the other point I'd make is that we've had staffing issues in the Scottish NHS way before the pandemic. We were down. We were going to have less GPs, 800 GPs down than we should have done. There were problems across any element of the NHS, whatever discipline. There were recruitment and retention problems, and in a way, COVID is a crisis upon a crisis that I'm afraid it is a health service that has been run by the SNP over the last 14 years.
Dave Duggan, how about that? There have been pre-existing problems. One accusation that's come from Conservatives and Labour is that the SNP didn't divert sufficient resources or spend them sufficiently effectively on the NHS.
Well, I don't think that stands up to scrutiny, Brian. And I think I would ask my colleagues from the Labour Party and the Conservative Party, to whom are they comparing NHS Scotland? Are you comparing it to the nurses per head in NHS England? Because I think we'd be having a very different conversation if people were to be a little bit more realistic about the challenges that health boards and governments face in recruiting and retaining and training within a fixed financial envelope. The NHS staff that we need. Let's be really clear. The NHS in Scotland does a tremendous job. We all value it, and the NHS wasn't being criticised by my colleagues there. So But it is, like all other public service organisations, reliant on a finite amount of funding, and it's a balance. We could throw all public resource at the NHS, but I'm not certain that's what the public wants either. So there's a continuous process of reform within NHS Scotland, but the challenges are very significant, and you can't just click your fingers in government and make these things happen. It's easy to make these proclamations from opposition, but when you're actually in government, these things are very difficult to manage. And
even after 14 years.
Go on, please. Yeah, go on, Martin. Go on.
I was going to say, even after 14 years. I spoke to someone only this morning who's struggling to speak to their GP because of, the rules that have been put in place. She wants to go and sit in the same room as the GP, and it's proving almost impossible. Mm-hmm. My own partner went to a drop-in vaccination only this morning because her second dose vaccination was so far in the future, but she was over the period of time. Yeah. I think it's all very well to say, compare it to this, compare it to that. However, when you talk to the people who live here in Scotland, when you talk to the people who are trying to use the NHS, who are queuing, as a friend of mine did with their son in accident and emergency, they're looking at a system where they are not blaming any nurse, doctor, or staff member. They are looking at the NHS on its knees, and that is the responsibility of the SNP government.
Briefly, Dave Duggan, and then I'm going to move on to another topic. Dave Duggan.
Well, I think there's no question about it that the public health measures that have been introduced in primary care settings are problematic for people in terms of getting a physical appointment with their GP. But that is a specific function of COVID, and that will be dealt with as restrictions release. Now, and I think actually people are very capable of being being pragmatic about exactly what they can expect from the NHS, because I think most people, despite sometimes what politicians say, most people are very, very, very pleased with the support and the health and the healthcare that they get from our territorial health boards, and that's a function of appropriate investment by Scottish government. Incidentally, we've had 14 years. Martin's absolutely right, and that's 4 elections that people of Scotland, who of course live in Scotland, Martin, have returned the SNP and put them in charge of the NHS. So I think
rub it in, why don't you? That's the way, Dave. Donald Cameron. Let me tell you something. Another issue that was raised by Nicola Sturgeon. She said she understood the pressure upon her to follow what was happening elsewhere, basically to follow what Boris Johnson is doing for England, which is pretty well lifting constraints altogether from 19th of July, although with certain elements deferred. But she seemed to be hinting that he'd gone too far on making it voluntary on face coverings, etc., etc. Do you think, Donald Cameron? Do you think that Boris Johnson has he sounded too gung ho on occasion, or do you think he's handled the coronavirus episode with balance?
Well, I think you're going to what the First Minister said. I mean, I've always maintained that Scotland and England have to, do what's best for them in terms of the public health advice that they've been given, and that we've all accepted. I think from the very beginning that may mean that paths divert. I think I imagine the Prime Minister is following the advice that he's been given by his scientists, who, the chief medical officer, etc. And that it is being, he is just adhering to that advice.
But is it really wise to be talking, as he has done, about Freedom Day and allow that sort of language to be used? And that tends to give the impression of, it's all over, it's all done, it's all sorted, it's back out into normal life.
Well, I think to be fair to him, I don't think he has personally trumpeted, that this is a great sort of moment of national liberation. But I think there is a very interesting philosophical difference, which is that he is more prepared, I think, to change from a kind of mandatory system to a more advisory system where public advice exists, and then it is up to an individual to take responsibility for their own actions. And I think that's actually a very interesting sort of distinction between him and Nicola Sturgeon, whereas it seems to be in Scotland that it's slightly more, the government has been slightly more interventionist.
Got a question from Brian Hutchison. The different approaches from Sturgeon Johnson, he says, are nothing but confusing. He asks, who's getting it right?
Well, I mean, I think, as I said at the start, I think the rules are becoming confusing everywhere because we're getting a plethora of rules, levels, systems, and enforcement is also inconsistent. So I think there's a general difficulty, which leads to less public compliance, which in itself is a problem. But in terms of who's getting it right, I mean, I think each country is doing the best for their own population and on the advice that they've been given. I think that's I don't think one can actually make that judgment.
And to be fair, Nicola Sturgeon made plain that the decisions taken by Boris Johnson were entirely in his own remit. She wasn't questioning or challenging them. Dave, what do you make about this? Who's getting it right?
Well, as Nicola Sturgeon, as our First Minister, we first to point out, I think it's probably degrees of rightness. I don't think anybody's got everything completely right. But a point I made yesterday in the SNP's opposition debate on COVID contracts in the House of Commons, if you look at the United Kingdom, which, let's be clear, is an island nation with a developed economy and a sophisticated healthcare system, we've still succumbed to 128,000 deaths from COVID, and we have an extremely high death rate per million, way above what Ireland's got. Ireland succumbed to 1,011 deaths per million. Japan, another island nation with a sophisticated healthcare system and a developed economy, has succumbed to 127 deaths per million. So, unfortunately, in my view, for Scotland, we don't have our hands on the big levers. We don't have our hands on the Treasury, on the Department of Work and Pensions, and on the borders, and on various other things. So we couldn't take those macro decisions that the UK had to take at the start. So we're lumped in with that too.
Yeah, just still on that, Dave. Just still. You've raised that. Let's stick with that. Your party has been very critical of UK government support for the economy, particularly the plans to remove the uplift in universal credit.
Well, that's correct. And I think that there's very little in this COVID crisis shows the disconnect between ministers in London and ordinary people and communities up and down these islands. This has been a tremendously difficult time for people, with people in receipt of benefits having that universal credit uplift to help with the additional cost.
The Chancellor says that was introduced for a crisis, and the crisis is demonstrably passing.
Yeah, well, that maybe it is in the kind of world that the Chancellor lives in, but I can guarantee you, for universal claimants in Angus and elsewhere across Scotland, the crisis is not disappearing. We've just heard from Baker Hughes and Montrose further job losses. If he thinks that the public health situation is inexorably linked in real time to the economic situation, he's kidding himself on. People are facing real hardship who are in receipt of universal credit, and the fact that they cannot wait, over and above the 3 million people they haven't helped at all, that they cannot wait to pull back this £20 uplift, it shows an unappealing and uncaring side to this UK government.
Martin Whitfield, then Donald Cameron on that point about assisting the economy and universal credit. Martin first, please.
Certainly, I mean, I would echo what Dave has just said. I mean, universal credit has fallen apart, but then to remove the £20 uplift so soon is ridiculous. It should have been made permanent. It has managed to help people who are in dire need through an appalling time. I visited a food bank only last week, and again, the numbers of people who are having to visit the food bank are rising exponentially, and they're not just unemployed people. They are people in work. They are people who are struggling, who have an income, who require universal credit to build that up. And now these people are being hit in the face by saying the £20 uplift is going to be taken from you. And just as Dave said, far from the end of this pandemic and how it will affect people.
Donald Cameron.
I mean, I just disagree with what Martin said. I mean, universal credit has not fallen apart. Universal credit as a system has not only survived this pandemic, it has worked. It is this new comprehensive system has shown that it can be effective. And also, let's not forget the United Kingdom government has put into Scotland £14.5 billion worth of additional funding in terms of and that goes for furlough, for various support schemes, etc. And I just don't accept that not enough has been done. And ultimately, we can't carry on with something like furlough forever. It has to. Any reasonable person would accept that it has to slowly draw to a close. And I think that is what the Chancellor said, and that is reasonable.
I'm going to have to slowly bring this to a close, but let me go around each of the panels, starting with Helen. Where are we going next? What's coming up next? Is it liberalisation? Is it concerns over winter? Do a bit of forecasting for me. A deeply unfair question, but there we go. It's part of my charm. Helen.
Well, I'm hopeful that what we're going to see is some sort of slowdown in cases. So I think we'll probably have some sort of half and half move forward, from July the 19th. I don't think we'll do everything, but we'll do some things. We're obviously for quite a while going to see the impact on hospitals, because even if cases slow down, we'll see the long-term sort of tail of that. And I suppose, the worries then are by the time we finish vaccinating all the adults, we still haven't decided what we're doing about the children. And we still haven't decided what we're doing about boosters. Those are going to be the next big challenges that we've got to decide.
Very briefly from the rest of you, please. Martin, then Donald, and then finally Dave Duggan. Martin Whitfield, please.
I would say that the area to look at with concern is the start of the university term. We have 17-year-olds who go to university in Scotland who can't get a vaccination at the minute because they're not 18, and they're going to be meeting 18-year-olds who potentially have had their first vaccination and waiting for the second. The return of the universities was a crisis badly handled last time. We still have a few weeks to sort it out. Let's see if that happens.
Donald Cameron.
Yeah, I'm positive and optimistic, and I hope that we do move to fewer restrictions and do so in quite short order. And I think hopefully we're in the public health science and statistics shows that we're in that position. I think the longer term challenges we've gone over, but I think the NHS and dealing with the backlog in operations, that there'll be several longer term issues that we will have to grapple with quickly.
Thank you very much, Dave Duggan.
Yeah, I'm hopeful very much for the restrictions easing as soon as possible, consistent with the underlying public health situation. I think that's a valid point about 17-year-olds going to university. I think we'll get down to the 18-year-old cohort and get them finished as quickly as possible, and then start the 12 to 17-year-olds as quickly as possible after that. The recovery in the NHS is vital, and it's in good hands under the SNP, with 25,000 more members of staff than there was in 2007.
Many thanks to my panel. Thanks to all of you for listening. Just time for a quick word from me about the big football game coming up this weekend. Yes, it's Kelty Hearts versus Dundee United in the League Cup. From me, Brian Taylor, to Lou the New.